Good afternoon. My name is Carolyn Rowe, and these are my colleagues. Today we're going to be talking to you about global health, and mine in particular will be about the global water crisis. So as we briefly discuss the issues of global health today, let's begin by defining the enormous size of this population and the vast spread of problems within. Across the world, there are an estimated 194 countries, and within these countries there are over 7 billion people. Each of these people and cultures face different health-related issues. Each of these problems directly or indirectly influence the health and economy in other nations. According to Healthy People 2020, the health of the U.S. population can be affected by public health threats or events across the world. In the more underdeveloped and still developing nations, we face the devastating issues of disease and death caused by insufficient resources of clean water, medical care, and health education. Some of these issues are related to maternal and child health, low birth weight babies, and HIV/AIDS. With this in mind, solving the immense problems of global health can seem hopeless, but we must remember our mission as health educators to promote health abroad by the rapid identification and control of emerging infectious diseases. In an effort to control the spread of these diseases, an intervention to solve the global water crisis has been initiated. So what exactly is the global water crisis? With the world's population having tripled over the 20th century, the use of renewable water resources has grown six-fold. Over the next 50 years, the world population is expected to increase 40 to 50%. If the availability of these water resources does not also increase with this increase of population, this presents itself as a serious global health problem, both today and for the future. So the facts are clear. When more people are added to a population, then the need for water, food, and shelter increases as well. Without the proper supply of these assets, these people will not survive. The most necessary nutrient in the human body is water. As you know, and as we all know, water is used for many things: for hygiene and cleanliness, for drinking, for agricultural production, for cooking, for numerous cases that I would take forever to explain. A shortage of water leads to malnutrition, and the risk for infection rises rapidly with the absence of sufficient water. There is a shortage, so let's discuss some statistics related to this. 1 out of 6 people lack access to safe drinking water, and of those who have access, 2 out of 6 lack adequate sanitation. 3.6 million people die each year from water, sanitation, and hygiene-related causes. In a more practical statistic, the water and sanitation crisis claims more lives through disease than any war has claimed through guns. So some of these problems due to the clean water shortage include agricultural production, bacteria or pollution found in the water, which lead to diseases. Some of the agricultural problems are water for irrigation and the watering of crops has decreased. In order for people to have enough food to supply for their families and in order for them to stay nourished, they need water to grow these crops. And so there's a lack of fertile ground, and there's a huge amount of crops that have been dying lately. For this water, for drinking purposes and for cooking, there's a large amount of bacteria and pollution found in most of the water's resources. The lack of sanitation is the world's biggest cause of infection. Bacteria causing diarrheal disease are extremely prevalent in most of the water's resources around the world. 1.8 million people die every year from diarrheal diseases, and 3.6 million people die each year from water, sanitation, and hygiene-related causes. Some of these diseases, as I mentioned before, are diarrheal, which 1 out of 5 of these have been with children under the age of 5. Half of the hospital beds in the world are occupied by patients suffering from diseases associated with lack of access to safe drinking water, inadequate sanitation, and poor hygiene. Though much progress has been made in this crisis, the crisis is still massively prevalent. So what is being done, and how can we, as health educators, help in this initiation? According to the World Water Vision Report, there is a water crisis today, but the crisis is not about having too little water to satisfy our needs. It is a crisis of managing water so badly that billions of people and the environment suffer. It is estimated that nearly 10% of global disease burdens could be reduced through improved water supply, sanitation, hygiene, and water resource management. So how do we improve these issues? There are 3 things that we can do. We can save the water resources by measuring and monitoring how much water is being used through hygiene related in cultures that have enough water and those that are suffering as well. Water is wasted not only when running, but also taking a look at the agricultural crops that are being produced. In order to grow 1 kilogram of potatoes, it requires only 100 liters of water. To grow 1 crop of wheat, it requires 1,000. To supply 1 kilogram of beef requires over 13,000 liters. So we must be smart in where we are using this water. We must also improve the water drinking supply. First, we must recognize it as a top priority through education and increasing awareness. Millennium Development Goals have been established by the World Water Council, and one of these is that by 2012, we aim to cut in half the proportion of persons without sustainable access to safe drinking water and sanitation. Education about drinking water only after treatment needs to be spread as well. Some of these include iodine treatment for water, boiling the water, just instructing people how to do that, sending heat treatments, and sand filters. So why hasn't this been done before? What are some of the things that are causing us to take a step back, and why hasn't this been solved? There are transboundary cooperations. They need to be established. Where water resources are being shared by different communities or countries, there needs to be a sort of treaty so that both communities can have enough access to this water. We need to guarantee the right to water, decentralize the responsibility for water, develop know-how at local levels of how to treat that water, and increase and improving financing through the building of wells, and evaluate and monitor water resources. There are many organized efforts that are on the forefront of this implementation, including the United Nations, the World Health Organization, and the World Water Council. Numerous organized efforts with a mission to make a dent in the global water crisis have been established. But huge progress has been made, but even bigger progress needs to be made.
Thank you, Carolyn. My name is Ashley Glover, and I will be talking on the topic of maternal and child health. According to Healthy People 2020, maternal and child health, the definition of maternal and child health is to improve the health and well-being in women, infants, children, and families. This is an important issue because pregnancy can provide an opportunity to identify existing health risks in women and to prevent future health problems for women and their children. Health risks can include hypertension, diabetes, depression, genetic conditions, STDs, tobacco use, inadequate nutrition, and unhealthy weight. These problems can be reduced by increasing access to quality preconception, which is provide health promotion screening and intervention for women of reproductive age to reduce risk factors that affect future pregnancy, and interconception care, which are steps to improve the outcome of future pregnancy. Factors that can affect pregnancy are preconception, health status, age, poverty, access to appropriate preconception, and interconception health care. Well-being determines health of the next generation and can help predict future public health challenges for families and communities and of the healthcare system. Some issues related to maternal and child health care are social issues influenced by environmental and social factors such as access to health care and chronic stress. Some physical issues are lack of access to appropriate health care before and during pregnancy. Some physical determinants of infant and child health is nutrition and behaviors of mothers during pregnancy and early childhood. Some specific issues include safe water and good sanitation, immunization, management of diarrhea, pneumonia and malaria, appropriate breastfeeding, and access to health care can significantly reduce child mortality. According to www.prb.org, in developing countries, almost 1/4 of newborns in developing countries are born of low birth rate, which is due to their which is due to their mother's poor health and nutritional status. Some objectives are to address a wide variety of conditions, health behaviors, and health systems, indicators that affect the health, wellness, and quality of life of women, children, and families. Some statistics pertaining to maternal and child health care. According to UNICEF.org, their goal is to reduce maternal mortality ratio by 3/4 by 2015. A woman in sub-Saharan Africa has a 1 in 16 chance of dying in pregnancy due to childbirth compared to 1 in 4,000 risk in a developing country. At least 20% of disease in children below the age of 5 is related to poor maternal health and nutrition as well as quality of care at delivery and during the newborn period. Yearly, 8 million babies die before or during pregnancy or in the first week of life. In conclusion, some interventions that can be done are getting the proper immunization, immediate and exclusive breastfeeding, care of low birth weight infants, treatment of infections. Just by intervening on these issues can prevent 63% of child mortality. Thank you.
Thank you, Ashley. My name is Amy Brock, and I'm going to be talking about low birth weight babies. According to Healthy People 2020, global health's goal is to improve the public health and strengthen the United States national security through global disease detection, response, and prevention and control strategies. Not only should we worry about the health in other countries, but we need to worry about the health of the United States and the surrounding countries. New diseases are emerging every week, and this affects not just the country, but the countries around them. The issue I'm going to be talking about today is the low birth weight in babies. Healthy People 2020 explains that the well-being of mothers, infants, and children determine the health of the next generation and can help predict future public health challenges for families, communities, and medical care systems. The rate of preterm babies has risen to more than 20% since 1990 to 2006. Global Health Facts determines low birth weight babies as newborns weighing less than 2,500 grams. This measurement is taken within the first few hours of life before significant postnatal weight loss has occurred. Many countries were on this list, and they gave different percentages of the low birth weight. Pakistan having 32%, and India having 28%, and these were done in 2000 and 2009. Many factors can contribute to this cause. As mentioned before, we have the water, and we'll be talking about HIV, and even malnutrition. One of the statistics that I found is 850 million people around the world today are malnourished. Also, inadequate sanitation may play a role. 2.6 billion people lack this adequate sanitation. Any of these factors could be a key health issue. As for controversies, I did not find any in my research. Many people want to raise their child to the best of their ability and to have a healthy family starting in the womb. But unfortunately, many families may not be able to. Some mothers may not know the proper care, or they could be medically or financial reasons may occur. Others, unfortunately, do not know the precautions, or they may have underlying issues. Some others even know about the causes, but they still do not care, and they consume alcohol or consume drugs, and this will affect the pregnancy. According to the health indicators, great strides have been made over the past decades to increase their expectancy at birth. 12% of infants are born preterm, and 8.2% of infants are born with a low birth weight. These conditions can lead to devastating and lifelong disabilities for the child. Different disabilities for the child may be visual or hearing impairment, developmental delays, and behavior and emotional problems that range from anywhere from mild to severe. World Health Organization explains that there are still 24 million low birth weight babies born every year. These babies are most likely going to die early. If the babies do survive, they will most likely suffer from illnesses, stunted growth, or even problems in early adulthood. About 27% of all children under 5 who are underweight, their mortality rates increase to 5 times higher. 50% of deaths among children under 5 are associated with malnutrition. The World Fact Book gives the number of deaths of infants who do not make it. Some rates are low as 2.21 in Japan, and some are as high as 121.63 in Afghanistan. One article that I read about talked about how low birth weight is a major global problem. In the article, it explains how there is a relationship between the health and the social economic development. Low birth weight is suggested as an indicator of social development. An estimated of 22 million babies are born each year with a low birth weight. The majority of them are in these developing countries. Different problems are found in the reproductive patterns, quality and quantity of prenatal care, social economic level, malnutrition, or infection. Appropriate technology would be needed to effectively reduce the low birth weight, and unfortunately, many countries do not have. In conclusion, I want to say that Healthy People 2020 talks about the international health regulations on how to approach serious public effects so that we will prevent these from the international spread of diseases. Countries are encouraged to work together to share information about emerging diseases and other disorders that can be prevented. Thank you.
Thanks, Amy. My name is Christina Kennedy, and I'll be talking about HIV and AIDS. I will be keying in on Rwanda and Sub-Saharan Africa pertaining to HIV and AIDS. Healthy People 2020 states that the United States is working toward improving global health. The United States has an abundant amount of resources, including a better healthcare system and programs that can improve global health. The United States is able to provide support for global health needs such as HIV and AIDS. One way the United States is taking a stand against HIV and AIDS and fighting for a change in the course of the disease is through a program called PEPFAR, which I will talk about later. Most of the issues with HIV and AIDS are control issues. HIV is spread through intercourse, blood transfusions, breastfeeding, during pregnancy, or during the delivery of a baby. HIV causes AIDS after the body has been weakened and the immune system is destroyed by the virus. The major issues include inadequate health care for people suffering with HIV and AIDS, the health of women and children, and abstinence. In Africa, the access and availability to health care is limited, and there is a lack of proper education and health care and vocational skills. There is also a need for more accessible healthcare systems for regions of the world like Sub-Saharan Africa. Women and children are affected the most by HIV and AIDS. According to Global Health Facts from 2009, 16.6 million children globally were orphaned by AIDS. These orphans are more than likely not going to get the proper education, nutrition, or care. This leaves children having to fend for themselves and resulting in a lack of nutrition, education, and a safe environment. Abstinence is also not practiced in many cultures. The lifestyle of people living with HIV and AIDS is a contributing factor to the epidemic. According to UNAIDS, sex work is still a major reason of the spread of HIV and AIDS, with a sad statistic that 76% of all women in the world who are affected by HIV live in Sub-Saharan Africa. Abstinence is no longer promoted a lifestyle, and unprotected sex is a prime way for HIV to be spread. According to the Global Health Facts, South Africa has the highest number of people living with HIV and AIDS. Out of the top 10 countries living with HIV and AIDS, Africa is represented the most with 7 countries in the top 10. Statistics from 2009 show that globally women are affected more with HIV and AIDS than men are, with the statistic being about 16.8 million to 13.3 million. Children also live with the disease with a staggering statistic of 3 million. Children who have AIDS and HIV can receive it from their mother through transmission during breastfeeding, childbirth, or while the mother is still pregnant with the baby. In Rwanda, the CDC reported that in 2010, there are about 130,000 orphans to AIDS. There are many actions being taken toward controlling this growing epidemic. PEPFAR is one of them, and it is a relief organization that is working to make a change. PEPFAR stands for President's Emergency Plan for AIDS Relief. PEPFAR is part of the President's Global Health Initiative. This program works with countries to help improve the health of their own people. The goals of PEPFAR include moving away from being an emergency response resource for countries to implementing programs so countries can solve their own problems resulting with the HIV virus. Strengthening the partnership of other countries to join the Global Health Initiative, increase the amount of care, treatment, and prevention available for people in countries that have major epidemics, incorporate HIV and AIDS programs to increase the impact of healthcare systems, and to invest in research for evaluation of the progress of programs implemented. PEPFAR is committed to improving the health of women and children. To improve the health of women and children, there are steps being taken toward making healthcare available, counseling available, testing and care available, and support for women with HIV and AIDS. These programs are also encouraging and strengthening communities to provide help for women and children who are in need and have major necessities. According to the U.S. Global Health Initiative, 2.4 million people have been supported with antiretroviral treatments as of September 2009. PEPFAR's efforts to prevent mother-to-child transmission has allowed 340,000 babies to be born HIV-free from mothers who are HIV positive. The CDC's Global AIDS Program takes a leadership role in researching, evaluating, analyzing research, and monitoring programs. In Rwanda, the CDC has been supporting the Rwanda Ministry of Health since 2002 in programs such as prevention of mother-to-child HIV transmission, the antiretroviral treatment, TB and HIV integration, couples HIV counseling and testing, and HIV clinical services. In conclusion, there are many programs being implemented globally to decrease and serve the number of people affected by HIV and AIDS. Thank you.